Welcome to the Wellness Revolution podcast, the radio show all about wellness in your mind, body, spirit, personal growth, sex, and relationships. Stay tuned for weekly interviews featuring guests that have achieved physical, mental, and spiritual health in their lives. If you'd like to have access to our entire back catalog, visit drveronica.com for instant access. And here's your host, Dr. Veronica.
Welcome again to the Wellness Revolution. Today, we're going to talk about panties. Yes, we are. We're going to talk about panties and your health because I have a lady with me, Jennifer Coken, who has a book, When I Die, Take My Panties. And we're going to talk all about where that came from, but we're also going to talk about a really serious subject, cancer and ovarian cancer. So I'm just going to welcome you, Jen, to the Wellness Revolution. Thanks for being on.
Thank you for having me. It's great to be here.
So Jen and I were talking a little bit behind the scenes about panties and ovarian cancer. I got to give you a little bit of this background. And I remember meeting her at this event. I met her twice. So that meant I really need to have this woman and talk to her. I met her twice and I remembered the book because it's talking about When I Die, Take My Panties. So we all have those embarrassing things we're not supposed to have. And for Jen's mother, it was hide my panties. Okay. So when I die, I want you to find my panty collection. Let me go out and buy some new ones. Some other things I may not want you to find, but know that they were helping me have a good time. I have the otherwise known as Bob. And if you don't have a Bob, otherwise known as a battery-operated boyfriend, you need to get one. Okay. So we're laughing all about these things. Life has a way of throwing us those curveballs. And for your mother, she had a curveball of cancer thrown in her way. And this is how you had the conversation about if I die, here's what you got to make sure you do for me, Jen. So Jen, let's back up a little bit. Tell us a little bit about your background, and then we could talk a little bit about your mother and how this came to be.
Sure. Well, it's interesting. I was in politics for 25 years, and then I did stand-up comedy, and I joke it was because I was in politics that I went into stand-up comedy because there was some fodder for that. But at the same time, I was a grassroots organizer for a long time. I was a life coach and I was coaching people for a big company. And then my mom, was diagnosed with ovarian cancer back in 2006 and began dealing with this whole diagnosis. And when she passed away, I said to her, I want your death to make a difference because her life, she was such an amazing woman. She was a teacher and a principal. She worked for NASA. She tap danced. She won Senior Idol at this competition in Florida. She taught all the women in her retirement home or retirement area tap dancing. And I wanted to write the book for her, but I also made it my mission to end the late stage diagnosis of ovarian cancer because it's so hard to diagnose. And I didn't want another family to go through what we went through. So the day before my book came out, I was laid off from my job. Third job I was laid off from. And I kind of went, okay, universe, what are you trying to tell me? This is my mission. This is what I'm meant to do. So now full-time author, life coach, stand-up comedian, and speaker. And that's how it came to be.
Wow. So you got downsized 3 times, and instead of saying, everybody hates me and I'm unqualified and why is everybody after me? You said, this is my opportunity to do something else. So that's wonderful. So your mother, let's talk a little bit about ovarian cancer because that's one of those cancers that people say there's no way to figure out what's going on. What was your mother experiencing before that?
So my mom, both of us have our Italian side of the family's bodies. I used to joke and say I got in the hips line and forgot the lips line because I have hips and no lips. But we always had these flat bellies. And it was hereditary in our family. And she had this pooch that she had never had before. And it was upsetting. And, she was sore in her belly. And this was a woman who was a vegetarian, rarely ate sugar, didn't drink, exercise, was a health fanatic, took her supplements, took extra things, for years and years. And she couldn't get rid of this constant pain in her belly. And that's really where it started. And they were treating her for many different things: irritable bowel syndrome, candida, all types of things that they were trying to figure out what was wrong with her, and none of it was making a difference.
Wow. So one thing that people have to understand about health is it's not just the physical, the structural, and the physiologic. It's also, there's an emotional and spiritual piece in there. And people say, oh yeah, mind, body, spirit. And that doesn't mean necessarily going to church. But your mother had an awakening. So it's common. So ovarian cancer is one of those types that we can talk about what that means from an intuitive standpoint. We talked a little bit off air right before about what was discovered and about a little bit about ovarian cancer. But people have to understand, okay, if you're out there and you're struggling with cancer, you have to start asking yourself some tough questions and answering some tough questions. And so the one question that you have to answer, if you have cancer, is, when did you decide you wanted to die? Usually, for people with cancer, there is some event in their life or something that made them at one time or another have a death wish that they didn't necessarily get over. It's not just, now think about it, you can do everything right and get cancer. You can do everything wrong and live to 105, no cancer. What is the X factor? And that X factor is that spiritual emotional piece. With cancer people, at some time, there was some type of death wish. So let's talk a little bit about your mother, because she had this very analytical background. She was doing everything right, yet she got this cancer. And then they said, well, it was misdiagnosed. And my question about misdiagnosis is, I asked Jen, did your mother have any idea there was really something wrong? Because most people know their body and they know there's really something wrong. So even though she wasn't saying it, she was saying, this is weird. I have these symptoms. I know my body. I have these symptoms. And she didn't put the ending on for verbalizing it, but she knew there was something going on. So tell us a little bit about that journey.
Yeah. So, I was mentioning she was a scientist. She had her PhD in educational statistics. So she was a very cut and dried person. If you can't see it, touch it, taste it, smell it, it doesn't exist. So did she intuitively know something was going on? I don't know that she was connected to her intuition to know. But this is something that's key, because we women know our bodies. And if we're connected to our bodies, then we can tell when something's going on. So I also believe, and she never said this to me, that she was very disconnected from her womb area and that area of femininity. Now, she tested negative for everything. All the tests that one would try to use to detect ovarian cancer, she was negative. So am I. I've had all the genetic testing, negative on everything. The interesting part here, though, is I was speaking to a friend in Florida who I met, and she was sharing with me, and she dug to try to find this research and couldn't find it because I asked her for it. There's research that shows that women who have ovarian cancer have had something traumatic happen in their life: a rape, a suicide, a death, a murder of a loved one, and blame themselves. My grandfather committed suicide. My mom went into spontaneous menopause after that event. So something happened where she cut herself off from that chakra, from that area, that I believe led to the ovarian cancer. And I do think, as you're saying, that it is our thinking and our belief system, and that choice we make, spoken or unspoken, conscious or unconscious, that we then choose we're going to die in this way.
Yes. So now this is not at all about blaming the victim. This is about empowering people to realize that they can turn on and off different emotions and different physical symptomatologies, including cancer. So one of my mentors, I'm trying to remember, what's her last name? Kit Hyatt, who founded Humankind, which is a homeopathic, had cancer. And now you think about it, she's in the health field, she's very, non-invasive, homeopathic, and she ended up with cancer, which in fact she did cure without getting chemo and radiation and all that, because yes, you can do that, and it was verified cancer. But she herself said, I had to deal with the time of when I had that death wish, and it was locked down deep, and I had to deal with it. I dealt with it, and then my body was able to heal. And so realize that this is something to know that's empowering. It doesn't mean, oh my God, you're going to die. If you don't, the people who end up a lot of times succumbing to cancer never connect back and realize there's something else you can do. Now, if you think that your emotions have nothing to do with your physical body, please go out and read Dr. Bruce Lipton's The Biology of Belief. That's a good starting place about how microbiology and cell biology and everything is turned on. But this is a triangle. You're a triangle. There's the structure, there's the physiology, and the physiology, that's the eating and exercise and supplements that everybody does. The structure, that has to do with your bones, your skeleton, and making sure everything's in the right place and the thing. But underneath, the base of that is your emotions. So if that base, it's like, if you don't have that, you know how you hear all other ground is sinking sand? They say that in religion. They say, on Christ, the solid rock you stand. It's on your emotions that have to be, you have to understand and unlock your emotions to be able for everything, all the pieces of the triangle to be equilateral triangle and to fit together and to be well. So your mother learned about her emotions. So tell us about her spiritual, wait, first, I want to know, tell us about this panty conversation.
All right. So my mother, I love her, adore her. She was always dressed to the nines. She always had a hat. She had her eyebrows done, her makeup on. That was just her way. She was not only a scientist, she was an actor in community theater for a long time and a performer. And years ago, she called me. She said, Jen, I found the most awesome thong underwear. They're called hanky pankies. Now, originally they were made out of cotton. They are made out of cotton handkerchiefs. That's where the women started it. So she got some for me. And then about a month before she was going to pass away, very practical, and a Jewish mother too, wanted to make sure everything was taken care of. And she was taking me through things like, here's a piece of jewelry I want you to have, and here's this gown, and here's a fur coat your grandfather made. And she pulls out this drawer and she goes, and look, there's about 30 pairs of hanky pankies in there. They're practically brand new. They've barely been worn. Goodwill won't take them. I'm not going to have you throw them away. Take my panties. And so I did. I took them when I was cleaning stuff out. And the funny part about your boyfriend Bob, I was cleaning my mom's stuff out and found her vibrator stuck behind some socks. I pulled it out and put it in the trash bag. My stepdad went to look through the trash bag. I'm like, no. I'll take out the trash. It's not a problem. Let me take that out for you. So that's where the title came in. And it's so interesting what you were speaking about in terms of, if you're not attuned to that intuition, that spiritual side. And I do believe that my mother having ovarian cancer was a purpose for her soul to be connected to spirit. It was part of her soul's journey to realize there was more than what her eyes could see, more than what her senses could actually see. Now, when she was diagnosed, she had less than a 30% chance of living 5 years. She lived 5 years, 1 month, 8 days, because she said, I'm not going to listen to what those statistics say. And one of the things.
Yeah, but yet she did.
What's that?
Yet she did.
Yet she did. Exactly. There's a point, I think there was a point where I'm sure she was grappling with it the whole time. But one of the things we really went to work on is, what are you resenting? Because cancer lives off resentment. And if you can begin to uncover, there was a lot dealing with her father who had passed away, a lot of resentment that we uncovered and worked through and processed for her. So I really believe it was part of her journey, and it was part of my journey to be with her and then find my voice as she was losing hers.
So did she get to the point where, you have this very analytical statistician? Did she get to the point where she embraced that there was something else, some other answers that she couldn't physically calculate?
Yes, and here's the great story. So, a very good friend who's a very gifted psychic and has been a psychic for 20 years. I talked to my aunt because my mom was up for anything. You know, she went to hands-on healing, all these things. Don't know if she believed it, right? But she was willing to try anything. So my aunt gifted my mom with some sessions with my friend Shoshana. And one of the calls, the Shoshana French, do you know Shoshana?
No, different one. Okay.
Person. Simple spirit, wonderful, wonderful human being. So she's on the phone with Shoshana, and Shoshana says to her, you know those stones that Jennifer got you? Because I got her a piece of jasper, which is to cleanse the liver and the organs. And I told my mom to meditate and hold that stone over her organs. She said, you know that piece of jasper that you have next to your bedside table? Quit leaving it there, and you want to hold it and breathe into it. In fact, I want you to go get it right now. So my mom doesn't react to it. They go through the whole session. My mom calls me. She said, did you tell Shoshana about the stones you bought me? And I said, why would I do that? And, my mom said to Shoshana, how did you know that? How did you know they were there? Did Jennifer tell you? Shoshana says, no, I'm a psychic. Like, how do you expect me to know? Of course, I'm a psychic. And then she called me to verify. I said, no, Shoshana's a psychic. She's very good. So I think it was in that moment that she realized, wait a minute, this isn't just a bunch of malarkey. There's actually truth to this. There's actually connection to that. And then she began opening up more and more to it.
Wow. So that's what I love the story. And I did not know that piece of the story was going to come in, because I do my work as a medical intuitive, which I hold almost higher or at least equal to my MD and all other hard science now, because I realize how important that spiritual emotional piece is. And that is what switches on and off people's physiology and can change the structure. And I've actually seen my own body change because I had limited thinking. Now, why do you need to work with somebody? I'm glad your mother went to the psychic. You need to work with somebody because you can't see what your limited thinking is. I've been in sessions and, I was in a session with actually, Kit Hyatt, and we were doing an emotional lock. And I couldn't come up with simple words to express something positive about something that had happened in my past. It was something that happened to me in second grade. I had anger and scared and hopelessness and all these things. And when she was asking me to put these positive opposite words of this, all of a sudden my brain was locked and shutting down. And she said, and I was standing in front, there was an audience. We were doing this because we're teaching other practitioners at the same time, and I volunteered. So I'm in front of everybody, vulnerable. She said, now you look at this brilliant woman who she can't come up with the words like she's two. All of a sudden showing how blocked I was about that particular issue. And so it's to tell people that when you have those emotional blocks, those emotionals are causing physical stuff to happen. All of a sudden, I release that block. And some of these pains that I was having in places, problems I was having, almost immediately, pretty much were getting better and almost non-existent. It's amazing to me. It's amazing to me. And I do this type of work. So, yeah. But I want to talk about something medical professional. So first you talk about the misdiagnosis, but you also talked about, they told her if she made it to 5 years and she was gonna, all right, so first doctors, I think you have to be careful as a practitioner what you speak.
Yeah.
Because you said 5 years and she said, well, I'm gonna prove them long, so I'm gonna leave 5 years in 1 month. But she had that 5 years there. The doctor planted in her, it was gonna be 5 years. And plus or minus a month, it was 5 years. We didn't even have 10%. We didn't even have 5%. She was 5 years.
Yeah.
And so I believe, why do I believe that happened? Because we're so in the construct of how the world works that when the doctor says, here's how it is, we believe this is how it is. And you pretty much adhere to what it is. In fact, there have been times where doctors have told somebody they were going to die, but told the wrong person. And the person who was supposed to die, they missed. There's a case like this. They told the wrong patient, went into the wrong room and said, sorry, the prognosis is bad, you're going to die. And the patient that was meant to die because they had this bad prognosis, that patient lived. And the patient that didn't have that diagnosis died. There are cases like that all the time. Doctors, anybody in healthcare must be exceedingly careful in what they say. And so people, when they say, how long do I have? My answer would be, I don't know. Because I truly don't know how long you have. Now, I can tell you what the statistics and the studies show, but that doesn't apply. Your mother, she knows this. Statistics don't apply to the individual. So people, when you go to the doctor, don't ask them how long you have. Live it as if it's your last day. You can go on Dr. Google and figure that out anyway. You don't need a doctor to say that to you. But if you want to Google it because you want to know, I'm going to live 5 years in one day, you're going to do that. No, statistics do not apply to the individual. Jennifer, what do you say about that?
Yeah, well, my mom was a researcher, right? That's what she did. So she was researching everything, reading every article, every book. So whether her doctor said it and it flew over her head because she couldn't handle hearing it, she was embedding that as she was reading all these different things over and over and over. And it's interesting what you said, no, live every day like it's your last day on earth. You know what I say, because I'm a type A. And I thought, if I'm living every day like it's my last day, I'm going to be crazy, frenetic, and running around. I say, live every day like it's your first, like you've never been in this day, like you haven't approached anything, like you're approaching your beloved newly, like you're approaching your friends newly, like you're approaching yourself newly, to let go of all those constructs. And when you were speaking about this whole issue of your change and how you let go of those pains, and you know this, that's why they call it dis-ease in your body. And we can tell if we're connected, if we're willing to connect. And it's something simple as waking up in the morning and saying, hello, toes, how are you? Hello, feet, how are you? Hello, ankles, and going up your body and saying hello, hello, hello to everything. Then you're connected to every inch of your body. So I'm a person who doesn't read that stuff. I trust my intuition. Mom, completely other side of the coin. So it was interesting. We chose each other, right, to incarnate in this lifetime. So it was interesting to have that dichotomy between the two of us. But I think part of it was her own desire to research everything to death.
And for a lot of people who I have people, now your mother, she was a researcher and did something with it, but I'll have people come and say, okay, I heard what you said. I got to go do some research. For most people, research is a procrastination technique.
Try to prove you wrong so they can be right about their opinion about something, even though they're coming to you as the professional and the person who knows, which is silly.
Yes. But now on the other side, as a professional, what is most impactful to people right now is the part that I do, which is not researchable easily. The medical intuitive piece where I'm figuring out. When I'm doing, going through and figuring out these links, like you think about the suicide and the ovaries, and, I get to things like, did this happen or that happen? I'm concerned about this there was some kind of relationship here. I'm concerned about this was a big deal for you. And, those kind of things come out. Those are the issues that we can't research easily. And so we want to discount. And I say the doctors are doing a disservice by making that cookie cutter technique. I was reading an article in the New York Times about here's how you prevent breast cancer. So we're not talking about oral screening and mammogram. Here's what you do to prevent. You stay this weight, you eat this food, you exercise this much, you blah, 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 blah. So the cookie cutter approach, yet sometimes people still get it. And I'm like, doctors are doing a disservice to not admit this other side, that emotional spiritual piece is quite important.
Yeah.
So here's what I want to ask those who have cancer. Do you want to live? You have to decide you deserve to live. Whatever it is, you have to be able to let go of it. And that might mean you need to have a counselor, but guess what? Sitting on a psychiatrist's couch and talking about it is not necessarily the best way. do an emotional block release like I did, where it's really gone. It's really gone. And I could feel my spirit lighter. I could see physical manifestations in my body that say, this is really gone.
Yeah, and that's important to realize, the thing you said about lighter. So people could say, of course I want to live. I've got my husband, my wife, my partner, whatever. I got so much to live for, but it still feels heavy to them. And you can tell it still feels heavy to them. That's a lie. They may say they still want to live because logically the brain will tell you it wants to survive. It's saying, I want to live. But what really needs to come into here is, okay, but it feels heavy. So what's underneath that? And what's underneath that? And what's underneath that? Just like your mentor, the work that she was doing with you to make sure that you really got down deep into whatever it was that was causing you all the pains in your body.
And so what about that? I want to live. I got my husband, I got my wife, I got my kids, I got my job, of course I want to live. Well, interestingly, that when you're saying that, then people say that is, well, do you want to live for you? Do you want to live for you? Because that's all that matters. All those other people outside, they don't matter. So if you don't feel that you deserve to live for you, you may heal the cancer and get a heart attack,
or get cancer again.
Cancer, or get another cancer again. And nobody can explain why. You're the woman where you had the breast removed and you got a cancer under the breast implant. Okay. And I'm laughing. I'm laughing, not because I'm laughing at people, but that I'm concerned that we don't have that really hard discussion with people. All right, now you have the diagnosis. When did you decide you wanted to die? And do you feel like you deserve to live? Because if you don't feel like you deserve to live, no doctor can give you anything. You can't eat the right food, exercise enough, lose enough weight, have enough mammograms, have enough x-rays, have enough whatever, have the surgery or whatever to allow you to live if you don't decide you deserve to live and embrace that.
And that's that part of the triangle you're talking about. You know, there is that quote unquote mind, body, spirit. That's that part you're talking about. And then the other side of it, because I want to make sure that people understand you've got to choose to live, and you also have to be attuned to your body. So what do you look for ovarian cancer? And there's actually 10-year-old research that shows ovarian cancer is not in the ovaries, it's in the fallopian tubes. And nobody's talking about this. They're still calling it ovarian cancer. They're still taking out ovaries. And, you know, the unfortunate part is there's 23 types of ovarian cancer. There's no test. Women think their pap smear test for it. That tests for cervical cancer, endometrial cancer. They have to do a biopsy. So there's no test. So what do you do in the meantime? Well, number one, you have to look at the symptoms. And on my website, there's a free symptom card and tracker that I got permission to use. Dr. Oz designed it with the National Ovarian Cancer Coalition, because most doctors, not you, but most doctors only deal in facts. So if you go in and go, you know, I'm kind of achy, that doesn't do it for them. You have to track your symptoms for 2 weeks. And if you have these consistent symptoms for 2 weeks and no change in diet or exercise interrupts them, go to your gynecologist, not your PCP, your gynecologist, and say, prove to me I don't have ovarian cancer. So an acronym, how do you remember it? BEAT, B-E-A-T, like beat on a drum. Bloating, eating, having problems eating, feeling full quickly, abdominal pain, and trouble urinating. More frequency, less flow. So bloating, eating, abdominal, trouble urinating. Now, women have those every month. What month goes by that you don't feel bloated just a little bit? An interesting piece of this, I'm actually having a hysterectomy June 5th. Why? I have fibroids that I was not attuned to, and I have one that's as big as a grapefruit that I've talked to my homeopath. We can't shrink it at this point, and I can get my wounds ready to go. She's like, I've served my purpose. She and I have had a conversation. It's all good. But I realized after figuring out that these fibroids had tripled in size, I'm like, wait a minute. The symptoms I'm having are actually stage 1 ovarian cancer. Now I know it's the fibroids, but I didn't associate the two. So even me, with all my knowledge, this comes about, and I realized, wow, that's why I have a chronic backache. That's why when I eat, I feel full. So women really have to be vigilant about those facts and how to determine those symptoms, and at the same time make sure you're connected to this intuitive part, to this spiritual part, because one can't happen without the other.
Talk about talking to doctors if you feel like you have these symptoms, because a lot of people go to healthcare practitioners. Their practitioners may poo-poo what they're saying. What should somebody do if they feel like they're being poo-pooed and there's something really going on?
Well, I think there's a couple things. One is, I believe for me, one of my soul's purpose in this lifetime is to speak my truth. I'm always working with a closed throat chakra. I think women consistently deal with that. So we've got to speak up for ourselves and speak up without judgment and without harshness, but be resolute in what we know about our body. That's why to bring that tracker. No, look, I've tracked these symptoms for 2 straight weeks. I couldn't eat on these days. I had issues on these days, etc. And if your doctor won't listen to you, that's done with that doctor. Go to a different gynecologist. And unfortunately, it happens a lot with male doctors to female patients. The belief is that we complain too much. We're hypochondriacs. Yet we know our bodies. And if you're attuned to it, you've got to take a stand for yourself and do not back down. Now, what can they do? Most of the tests they would do really don't show anything. A CA-125 for the elevated blood protein, 80% false positive. You can be tested for the BRCA gene, the breast cancer gene, and women are up to 40% more likely if they get tested positive for that to get ovarian cancer. Still not conclusive. They can do an ultrasound, they can do a CT scan, they can do an MRI, but then they'll be able to see what's going on. Ultimately, until they biopsy that tissue or remove some tissue, they won't know it's ovarian cancer. So you've got to take a stand for yourself. The reason I brought up this issue between your fallopian tubes and your ovaries, had I known about this research when my mom was diagnosed and when I was thinking about having a hysterectomy, I did not want to do that. I wanted to go into menopause naturally and not throw my body with the increased potential for heart disease and osteoporosis. I would have just had my fallopian tubes removed. If that was going to decrease my chance, then I wouldn't have thrown myself into menopause. Women of childbearing years could have their fallopian tubes removed and still be able to have children. There's great research that can happen, but nobody's talking about it. There's one doctor that's talking about it, and Dr. Mark Boguski, and he says, why are we still calling it ovarian cancer? It's crazy.
Because it takes 17 years for research to get to the mainstream. So we got 17, 20 years before they start calling it something different or admitting something different. So now the other part of this is, I know, for doctors, we like to be very hard in the symptom tracker and everything like that. And one thing that I know from some of the scans that I do and have learned how to do, that there are certain patterns that can be consistent with a cancer pattern. So if people are interested in that type of service where they want to come and say, do I have a scan that could be consistent with? I would be willing to scan people and say, yes or no, it's consistent with, but that doesn't mean once you have one of these remote scans, because I do things remotely, that it's true. But if I get something where I'm concerned that it's consistent with that, I'm going to push and push and push and push on your behalf, because I know there's certain patterns that we get, and they're, I'm not going to go over how we know that it's complicated. It's complicated, but it's not complicated when you know how to do it. There are patterns, energetic patterns that are consistent with cancers and tumors. And in fact, a lot of those energetic patterns, we can even pinpoint towards where it is in the body, what energy area, what area. So there are doctors that know how to do that. This is not something that's considered mainstream. We always are very careful about our languaging. We don't say, you have cancer. I'm going to say it's consistent with a pattern of people that have had cancer. And so I think you should, so it's not a diagnosis, but it strongly means get thee to the doctor you can get a diagnosis in some other way. So
yeah, but it's so important to have someone like you as your advocate or listening, or you need more doctors out there who, whether they're trained to be a medical intuitive, are connected to people, because so often 7 minutes to see a patient. How do you leave that person taken care of? Somebody like you, leave somebody taken care of. So we need to get you replicated. We need a bunch of clones.
So the idea behind doing this, and I tell other people why I'm a medical institute, I'm not doing this to be a human MRI. I know that if I pick up a pattern consistent with, then the next thing that I can do, even though you're going to get other therapy possibly, is support you so you get the best outcome possible. So that means let's get your body more in balance. Let's figure out what is the eating strategy that we're going to use based on your body type and everything that we get. What are the supplements that you can, what can we do that's going to complement, not interfere or anything else, but it's going to complement you getting the best outcome possible. And so that's what it is. This is not alternative. This is complementary, meant to stand side by side. I want you working with a traditional doctor. I will not work with you unless you are, because I believe everything's necessarily not one or the other. Everything is necessary. So therefore, even if you decide you don't want chemo, you don't want something, you don't want surgery or whatever, you're going to be with somebody else that if a crisis comes up, you can change your mind and get the chemo, the radiation, or the surgery. But we may decide, okay, you want to go another route. You're going to do that fully consenting with somebody else so you fully know what all of your options are. It's about knowing all of your options. And so that means if you're picking an option that's complementary, you've also know why you may not want to pick another option that's chemo, radiation, or surgery. Everybody needs to make that decision individually. But realize when you have a big diagnosis, that's a signpost in your life that something has got to change. And so your mother started buying thongs at 60. And I love it. So tell us the name of your book and where we can get it and your website.
Great. The book's called When I Die, Take My Panties, Turning Your Darkest Moments into Your Greatest Gifts. Because just like you pointed to, I do believe that everything that is put in front of us is an opportunity to learn and grow. And so the book isn't just about my journey with my mom. It's some things that have happened to me in my life where I chose growth. I chose the harder path. It wasn't easy. It was simple to choose the harder path, but it wasn't easy to choose the harder path because I was committed to growth. So When I Die, Take My Panties, Turning Your Darkest Moments into Your Greatest Gifts. Any of your bookstores, Barnes & Noble, Powell's, any of your local independent bookstores will carry it. It's online as well. And you can find out more about me and the book and what I do as a life coach at www.jencoken.com, JenCoken.com.
Beautiful. Jen Coken, thank you for being on the Wellness Revolution.
Thank you for listening to the Wellness Revolution podcast. If you want to hear more on how to bring wellness into your life, visit drveronica.com. See you all next week. Take care.